Dogs? No way, not that one. Parvovirus that affects dogs is not the same as a human Parvo B19 virus. Parvo of dogs is different and cannot be passed from dogs to humans. We will talk today about the virus that affects humans, the Parvo B19. It was first discovered in 1974 while testing blood units for hepatitis B virus in asymptomatic donors. The name originates from the coding of a serum sample number 19 in panel B that gave anomalous results. It was first linked to clinical disease in 1981 and in transplant patients in 1986. Let's give the story a listen. Throughout Petra's pregnancy, all of her friends came to see her at home. One of them sneezed in her face, infecting her with the Parvo B19's virus, which is the smallest, single-stranded, naked, non-enveloped DNA virus. Petra, the mom, later developed chronic arthritis from the virus in her small joints, and that was it. If this happened early in pregnancy, her baby could have developed hydrops fetalis or suffered a miscarriage. Fortunately, she was in her third trimester, and the pregnancy was uneventful. Paula, her baby, grew up and started kindergarten. Paris, Paula's friend in the kindergarten, sneezed in her face and transmitted the Parvo B19 virus to her. Paula began to experience flu-like symptoms. A week later, she developed a rash on her face that looked like someone had slapped her on the cheek, and the rash spread to her entire body. Parvovirus B19 is also known as the fifth disease. The virus travels through the blood, which is the viremia phase, and resides in the bone marrow precursor red blood cells, where it arrests and destructs them. Therefore, it causes aplastic anemia with a low reticulocyte count. The rash with arthritis and arthralgia are caused by the killing phase of the precursor red blood cells. As a side note, remember, the first disease is measles, the second is rubella, the third is chickenpox, and the fourth is roseola. Up till now, there is no vaccine available for disease number 4 and 5, roseola and parvo. Clinical presentation of Parvovirus B19 is wide. As previously mentioned, it resides in the bone marrow precursor red blood cells and may be completely asymptomatic. Patients with sickle cell anemia, hematological disorders, and immunocompromised patients, including transplant recipients, may develop significant red cell precursor destruction, resulting in erythropoietin-resistant aplastic anemia, low white blood cell count, and low platelets. Furthermore, the viral infection can result in chronic arthritis, arthralgia, hepatitis, which is liver inflammation, neurological side effects, myocarditis, and most importantly, kidney graft dysfunction ranging from protein in urine to failure. In transplant patients, the Parvo B19 virus may be donor-derived, which means it is transmitted with a transplanted kidney, so keep an eye out if the donor was seropositive, IgG positive, and the patient was heavily immunosuppressed. How do we make a diagnosis? If there is a clinical suspicion, check Parvo B19 plasma PCR in transplant patients. A bone marrow biopsy is almost never required. The key is to have a good clinical sense: resistant anemia, arthritis, myocarditis, and graft dysfunction. How do we handle a positive result? Simply let the patient's immune system handle it. Reduce their immunosuppressive medicine, cut the MMF dose by half, or discontinue it entirely depending on the clinical severity. You can also give your transplant patients extra immunity by giving them IVIG. Typical dose is 0.4 gram per kg times 5 doses. You can give it weekly or every other day, total of 2 grams per kg. Continue to monitor Parvo B19 PCR on a weekly basis. That's all. Thanks for listening. And again, Parvo B19 is not the one that affects dogs. Thanks for listening. Talk soon.